Today I'm going to talk about the mental disorders. Let's see. First, we will talk about the schizophrenia mental disorders. What is schizophrenia? What is the definition for schizophrenia? Schizophrenia is a chronic mental illness with symptomatic manifestations of hallucination, delusions, and social withdrawals. It is usually begins before age 25 and it persists throughout of the life and affects persons of all social classes. It means they will be in the dream world. Hallucinations means they have seen, heard, touched, tasted, smelled something that was not actually there, but they feel like that. False perception of objects or events involving your sense. Nobody's there, but they feel somebody's speaking with them, somebody's touching. It is hallucination. Next, delusionation means false belief. Next, social withdrawals. They will not mingle with others. There's all kind of symptoms present in schizophrenia patients. What is the causes for schizophrenia? It may be genetics, structural changes of the brain, previous drug users, and environmental risks. This is the causes for the schizophrenia. Next, we'll see about the symptoms. Positive symptoms: hallucination, seeing or hearing things that are not there; delusions, strong false beliefs despite contrary evidence; disorganized speech or thinking, incoherent or illogical speech, and difficulty organizing thoughts; abnormal motor behavior, unpredictable or bizarre movements. This all comes positive symptoms of schizophrenia. Then next, negative symptoms: blunted affected, reduced emotional expression, alogia, poverty of speech, and hedonia, inability to experience pleasure, apathy, lack of motivation and interest. It's all negative symptoms of schizophrenia. Next, we'll see about the types of schizophrenia. First, paranoid schizophrenia. It means hallucination and delusionation is paranoid schizophrenia. Next, disorganized schizophrenia. The subtype is marked by disorganized of speech and behavior. Their speech will be disorganized. The next, catatonic schizophrenia. It is associated with multiple psychomotor abnormalities and behavioral dysregulation. Behavior dysregulations means the regular activities will not be there. Undifferentiated schizophrenia includes lack of emotional depth and ideation is simple and refers to concrete things. Next, residual schizophrenia. It is the recovery phase as severe symptoms usually begin to reduce or fade. This all comes types of schizophrenia. Let's see what are the treatments for schizophrenia. First, antipsychotic medication. Second, social skills training. Third, electroconvulsive therapy. Fourth, individual therapy. Fifth, occasional rehabilitations. Sixth, family therapy. Seventh, hospitalization. Eighth, lifestyle changes. This is treatments for schizophrenia. So here we have seen what is the definition for schizophrenia and what is the causes, what is the types of schizophrenia and what is the treatment for that. So let's see about the manic depressive psychosis disease. What is the main causes for this disorders? Genetic reasons, brain structure abnormalities, trauma, environmental, chemical imbalance. This is the causes for this disease. Next, what is the signs? Decreased performance at work in school, less than ordinary attention to personal hygiene, difficulty in communicating, difficulty in concentrating, reduced social contact, unwarranted suspension of others, emotional expression and anxiety. Let's see the symptoms. First, mania will see talking excessively, racing thoughts, hostility, less sleeps, delusion. This all mania symptoms. Depression symptoms: extreme fatigue, prolonged sadness, memory loss, poor nutrition. This all comes in depression symptoms. This is the signs and the symptoms of manic depressive disease. What is the treatment for this disease? It is also called bipolar disorders. Treatment is psychological therapies, prescription medications, alternative treatments, and lifestyle changes. This all treatments for bipolar disorders. Next, we'll see about what is paranoia. Paranoia is the irrational and persistent feeling that people are out to get you, or that you're the subject of persistent intrusive attention by others. This unfounded mistrust of others can make it difficult for a person with paranoia to function socially or have close relationship. This is the definition for paranoia. Let's see what is the causes. Trauma. Second reason schizophrenia. Third bipolar disorders. Fourth paranoid personality disorders. Fifth stress conditions. Sixth lack of sleeps. Seventh substance use. Eighth fear of familial influences. Ninth physical illness. This is the causes for paranoia. Let's see symptoms of paranoia, mistrust of others, increased isolation, hypervigilance, reluctance to share personal information, finding hidden meanings in benign situations, having difficulty relaxing, stubbornness and hostilities. This is the symptoms of paranoia. Next, we'll see about the treatment of paranoid personality disorders. It be treated through a variety of medications and types of therapy, including the cognitive analytical therapy, cognitive behavioral therapy, dialectical behavioral therapy, and lifestyle changes. Let's see the therapies. Cognitive behavioral therapy. It can help the people understand the relationship between their thoughts, feelings, and behavioral responses. Next is group therapy. It supports and can help people better understand their behavior within the context of social relationships. Next is the family therapy can be helpful if a child or adolescent struggles with paranoia. Next, experimental therapy often beneficial for people who struggles with traditional talk therapy. Okay, this is the therapy for paranoia. Next, let's see what is the scope with prevent paranoia. Get enough sleep, maintain a healthy diet, refrain from substance uses, set media limits, engage in meaningful activities, practice cognitive restriction, avoid isolating, take medication as prescribed. So here we see about what is the definition, what is the causes, and what is the signs and symptoms, and what is the treatments, then how to prevent the paranoia disease. Let's see what is a psychoneurosis or anxiety based disorders. Definitions: mental or personality disturbance not attributable to any known neurological or organic dysfunctions. One more definition is according to DSM-4, generalized anxiety disorders may be characterized by the excessive, chronic, distressing, and free-floating anxiety and worry those source the sufferer cannot specify, which cause clinically significant distress or impairment in the key areas of functioning and which is difficult to control. This is next. Let's see the causes. Genetic causes: chemical imbalance, serotonin or dopamine imbalance, trauma, childhood sexual abuses, conflicts, anxiety in the brain, stress. These all causes for the anxiety disorders. Next, see the types of anxiety-based disorders. First, generalized anxiety disorders and panic disorders, phobic disorders, obsessive compulsive disorders, post-traumatic stress disorders. These all four types anxiety-based disorders types. The symptoms of anxiety-based disorders. It is symptom autonomic hyperactivity were also included, such as shortness of breath, rapid pulse rate, sweating, dizziness, and nausea. This is the anxiety disorders symptoms. And also included excessive worry or uneasiness, increased irritability, muscle tension or aches, restlessness or feeling on edge, difficult concentrating, fatigue or tiredness. This is also included in anxiety disorders. Let's see the neurotonic behavior symptoms. Exaggerated use of avoidance behavior, exaggerated use of defense mechanism, and maladaptive and self-defeating behavior. This is the neurotonic behavior of anxiety disorders. So here we will see the autonomic symptoms and neurotonic symptoms and other symptoms included in this anxiety-based disorders. Let's see what is the risk factors for generalized anxiety disorders, chronic illness, job stress, certain personality traits, genetics and brain chemistry, traumatic experience, alcohol and drugs, mental health disorders. How to manage these anxiety disorders? Talk to your manager. Take time away as necessary. Work on one task at a time. Practice good sleep and hygiene. Attend therapy. Work during your lunch hour. Here can see three strategies: social scoping strategies, physical scoping strategies, emotional scoping strategies. And tips for scoping with anxiety: focus on what you can change. Figure out what is bothering you. Stop and breathe. Focus on something less anxiety provoking. Let's see the 13 ways to cope with anxiety. Question your thought pattern. Aromatherapy, ask about medications. Then take deep breathing exercise. Identify and learn to manage your triggers. Change your diet and supplements. Grounding technique use exercise and therapy, talk therapy. Stay active, exercise, daily or routine, medications, meditation, journal, socialize. This is the ways to cope with anxiety disease. Next, see about the personality disorder. Definition: when enduring patterns of behavior and emotions bring the person into repeated conflict with others, and when they prevent the person from maintaining close relationship with others. See the causes: genetic factors, environmental factors, neurobiological factors, childhood experiences, community and social support. Let's see the signs of personality disorders: issues with self esteem, difficulty with empathy, inconsistent values, problematic parenting, relationship problems, trouble dealing with stress, work difficulties, low self awareness, trouble with boundaries, difficult regulating emotion. Let's see the symptoms: impulsive and risky behavior, unstable self perception, difficult relationship, mood swings, paranoia, volatile behavior, neglected hygiene, cognitive impairment, self injuries, and suicidal behavior. This is the symptoms of personality disorders. Next is the types of personality disorder: cluster A, cluster B, cluster C. Cluster A is overthinking and eccentric behavior. Cluster B is traumatic and erotic behavior. Cluster C is severe anxiety and fear disorders. Here under this explain the disorders. Types of disorders explained here. You can get information from this page. What is the scope with personality disorders? Psychoeducation, practice self-care, avoid substances use, and relaxation stress management techniques, develop healthy hobbies, communicable with your loved ones, spend quality time with close ones, join a support group, and maintain a disciplined regime of therapy and medications. This is the scope with personality disorders. So here in this videos you can see in what the definition for schizophrenia, causes and signs and symptoms, and what is the treatment, and also you can see in other types of mental illness. What is the major mental illness? Schizophrenia, manic depressive disease, and other diseases of paranoia. These three diseases major illness of mental disorders. Other minor illness of mental disorder is anxiety based disorders and personality disorders. These two disorders are minor illness disorders. So five kind of disorders you can get information from this video. And thank you for watching. In this video, you get some information about mental disorders. You can take this information for your mental health camp or mental health education to other peoples, for schools, for colleges, for workers peoples. You can talk about this disease and you can prevent this mental illness around around our societies and around our nations. So you can take some information from my videos and please benefit from my videos. Thank you for watching one more again, and subscribe my channel also. Thank you.